Okay, so this is section 1, the equipment section. We will be using, of course, water. It could be hot with fiberglass, a chucks pad, fiberglass with a color layer, gloves, tape, and some cotton and stockinette, and that's all you need to get going. Okay, so the second section is the padding section. One of the most important parts, because you do not want to over pad. You want to make sure most of your padding in a cast is 50-50, because we're trying to be really attentive to stabilization. Now your endpoints, like I'm starting at the endpoint of metatarsal heads, can have 3 to 4 layers of cotton, so you don't want that fiberglass digging in at the edge. Next, as I move into the ankle, I've already positioned them, of course, at 90 degrees, have a stockinette already on the patient. And now I'm fan folding padding into the heel. The heel is a pressure area because they rested on there. So make sure you either go back and forth with some cotton there, or if you have adhesive foam or felt, you could have put a little bit on the heel for them to offload so they don't possibly get a pressure ulcer or some skin breakdown. Other than that, it's a 50-50 trend to the top. What you're looking for is that you stay consistent with that. If you get shadows, which was the black stockinette really shows well, it would look like a dark spot because you only went over it once and the stockinette is kind of coloring through that. You would have to go over it again because you definitely want that 50-50 layering. Of course, the top is going to be another endpoint that needs at least 3 to 4 layers. And if it was a knee scooter person and they told you, hey, I have a knee scooter, I'm getting one, you would want to put some felt and foam extra at the top of the tibia because the knee scooters put a lot of pressure there, and you could also have skin breakdown in the front. As you see, I covered up that shadow on the front. But that is it for padding. Okay, so this is the third section, which is the first layer of fiberglass. It is a very important section because we're going to be setting the degree, which for this cast is going to be 90 degrees with the fiberglass, and we're going to want to maintain that without wrinkling the fiberglass or putting an indent due to the foot stand that we're using. Of course, first is equipping your gloves. Always use gloves with fiberglass. Please do not just bare hand a fiberglass roll. It will not do well on the skin. It'll take some while to get that off. White is normally the common color we use for the bottom first layer. Of course, color could be used. It is a little bit more expensive, but it could be used if you had no white fiberglass to use. With this one, there's going to be no toe plate, so we're just going around the metatarsal heads a little bit further forward 3 times to give it some thickness. And then up we go, 50-50. You will have to do some kind of figure 8 pattern, especially depending on the size of the ankle, to kind of get through the ankle joint. This is where the foot stand really helps when you're new to this. It holds the degree for you, and then you can work your way around the ankle, making sure that any little points that are popping up you're tacking down so it gets molded well down and not a wrinkle. Also, you don't want to shift too much right here, just laminate it down. Be careful with indentations by your finger or pressure. That kind of stuff can also indent the fiberglass. As you see, I had to readjust that endpoint. Always come below wherever your endpoint was with the fiberglass, and also do not pull. I am very much so just laying and rolling. Do not actually crank these rolls. You can cut circulation off or make it super uncomfortable for the patient if you're pulling. So just kind of glide with the roll, lay it down. If you have little, I like to call them bell bottoms where the fiberglass didn't lay well because they have a bulky calf, stuff like that, you can come back around and go down a little bit and anchor those parts down, and they will lay down. So do not worry too much if it's bell bottoming a little bit due to they had a very distinct calf. That's fine. You can come back and get those. So do not think that they are permanent and now you're going to fail your cast and you're failing your patient and this is just not going to work out. No, you can come back down and catch those. For this part, transitioning, you do not want to leave them on the foot stand too long because you can indent the bottom, curl over the bottom, or just put a huge wrinkle in the arch area. So don't leave them on there for too long. Once you finish all the way up, transition them to either how I have them on the chucks pad on my thigh. Again, do not put them on your knee either. You don't want an indentation, so make sure it's on your thigh and it's flat. This is a part that people struggle on because you can get external rotation, internal rotation. Like you can mess up the position and then you'll be redoing the cast. So make sure you found a thigh part that is flat. You can also use a board I've seen. You can put them down on the 4-corner foot stand with a chucks pad and have them just stay there. But you definitely need to hold this 90-degree position until it dries, laminating down and doing some molding. Molding can be gentle, but flatten out that toe area, a little bit of laminating on that ankle, and then some interosseous on the calf. And that's it for section 1 of the fiberglass. Okay, so section 4 is a pretty simple section. You're just going to be trimming and folding. Your molding is already done because your first layer of fiberglass is on. It's already hardened in the 90-degree position that we wanted. So all we're doing is, like I'm showing, folding the stockinette over the edge. And do the cotton individually like I did. Do not just yank the stockinette down. It's a very bad technique to do. You think you're saving all this time by just yoking the stockinette down. It folds the padding how you want it, but that's not actually true because sometimes the padding will go inside. So make sure you individually fold down that 3 to 4 layers of padding over that fiberglass edge, and then fold down the stockinette nice and tightly. You do not want to, like I said, just yank it down. There's a chance that it will go in, and then there's no padding on the edge. So your edges will be what I would like to call super serrated or sharp, and you do not want that against your patient at all, especially if they have a knee scooter. So, but even normally you wouldn't want like a real super rough, sharp edge against them, so you want it well padded. Next, we're going to be marking. Once you get better at this, you don't have to do this part. You'll kind of see the contouring of the foot with the fiberglass, and you'll kind of know where you need to cut. But what we're aiming for is to free up the web spaces on top and then support the metatarsal heads on the bottom. We rolled past because that is a good way to do it when you're first starting out, because people tend to just roll up to the metatarsal heads and up to the webs, and then they're like, oh, I don't have to do as much cutting, and just trim it with my scissors just to build it. But the problem with that is a lot of people will miss the metatarsal heads, and you won't be supporting them on the bottom, which with a normal short leg cast, we would love some support on the metatarsal heads. Phalangeals can stay free. Toe-toes are fine to be free and moving, but supporting those metatarsal heads in that forefoot aspect is really important. So you got to make it on the bottom. So if it requires you to trim like we're doing here because you rolled past it, then that's just what it is. It doesn't take that long. People say, oh, it's just so time consuming. It's literally maybe a minute and a half to trim it out if you're good with the saw. So really is not that time consuming to do things correctly. So I highly recommend always rolling past it. Now, you might not have to roll past as much as I did in this video, but definitely rolling a little past it will not hurt you. And sometimes you don't even need a cast saw. You could just do it with the scissors. We did the top first. Once you've got the top, you just fold back the cotton again over the edge because we don't want to just yank the stockinette, and then you'll have a nice clean edge. Web spaces on top should be free, so where the toes end in between each other, that's the web space, and you just want that free, so the toes don't get pushed up. And that's pretty free there. So we like that. So once you like it, of course you would finalize it by taping it down, but a finger length to the web spaces or half a finger length is more than acceptable back from it. This way they can bend their toes up and down and not hit any fiberglass edging. The bottom you want on that metatarsal heads, which we have, and once you get that part, if you had to trim again, you would of course do that. And once the crisp edging, you see the metatarsal heads are supported, you're going to take some tape. I prefer silk tape, but you can use paper tape. Again, this part of the cast, the first layer is already dry, so you can be a little taut with the tape to tape this edge, but make sure you give a little bit away from the toes with the tape, so don't go right at the edge. Back up about 2 finger length widths away to tape it down, and then secure it in place so it doesn't contract back. Once you've done this, you're pretty much secure. Anything past the tape, think of it like a trim point. Anything above the tape, you will be trimming off. And that's the 2 reasons. 1, it's going to help adhere the fiberglass better. And 2, it makes it easier to cut them off when a tech has this come in for an XOP. So it does have a double compartment function to cut it off. It makes it much harder to cut off along with it doesn't adhere as well if you don't trim. I'm also trimming the top. There was an excess. Did not tape it. You are more than happy to tape the top if you want the same as we did the bottom, but it is normally not necessary. It actually folds well and stays where you put it, so I normally do not tape the top. Once you've done that, you are going to be ready for your second layer of fiberglass, the money roll, as they would say. Okay, so section 5 is just the second layer fiberglass. The color option is up to the patient. Normally you would ask them if they want pink, purple, whatever you have. They would pick, and then you will of course dip it like you normally do in water, squeeze it out, and then apply it like you've done the fiberglass before this layer, leaving a finger width of stockinette exposed, but making sure you secure where you taped and over it on the bottom and top, so none of that comes loose. The final layer does two things. One, it makes it nice and pretty for the patient. It color coats it, very display and very aesthetically appealing. The second thing it does, it reinforces your cast. So feel free to do a couple extra roll arounds at the heel if you wanted to, and a couple at the ankle. And after that, just 50-50 all the way up. Shouldn't take more than 2 rolls. Sometimes you can do it in one depending on the size of the patient. But that's pretty much all there is to it. If you, of course, need the second roll like I did, just open it up. Make sure that you go lower than wherever your end point was with your previous layer, so you can cover up that end part of the fiberglass. So as you see, I dipped underneath so I could cover up that fiberglass, so aesthetically it's no longer an end point. And then I continued up at the top rim, again, finger width away, and leaving that stockinette helping with padding so you don't encroach, because if you encroach you could dig into the patient if you pass that black stockinette area, so you don't want to do that. As you see, I'm cutting toward the back. It's intentional. You do not want that aesthetic ending on the front of your cast. You'd prefer it in the back where nobody really sees it. And after that, just laminate it down. The more lamination you do, if you have to wet your hands, the more smooth the cast is texture-wise. And it helps because it won't mess up patients' clothing or sheets and that kind of stuff, so upholstery. But that's it, all done with the short leg.